सो हेलो एवरीवन, वेलकम बैक टू द चैनल मेरे जर्नी। आज हम डिस्कस करेंगे टिबिया बोन के बारे में, इसके साइड डिटर्मिनेशन फीचर्स अलॉन्ग विद द एक्सटर्नल फीचर्स, इसकी मस्कुलर और लिगामेंटस अटैचमेंट्स, ओके, एंड द जॉइंट्स जो इन्वॉल्व होता है फॉर्म करने में। क्लियर है? सो लेट्स स्टार्ट विद द साइड डिटर्मिनेशन फर्स्ट। साइड डिटर्मिनेशन के लिए सबसे पहले ये जो टिबिया बोन होती है, यह हमारे मीडियल साइड ऑफ द लेग की बोन होती है। दिस इज द बोन ऑफ द लेग बिकॉज थाई में हमारे पास फीमर आ जाती है, एंड दिस इज द सेकेंड लार्जेस्ट बोन ऑफ अ बॉडी। फर्स्ट लार्जेस्ट बोन इज द फीमर एंड दैट इज ऑफ द थाई. This is of the leg which is situated medially, and it is morphologically identical or homologous, we can say, not just identical, it is homologous to the radius of the upper leg. Yes, so this is basically tibia. It is a typical long bone which has the upper rounded end, the lower little narrow end, and also the shaft in between. Clear? So this is tibia, and इसकी अगर हम side determination की बात करते हैं, then we are having the upper rounded, lower narrow end with separated by the intermediate shaft, along with the tibial tuberosity which should face anteriorly, and the medial malleolus which should be directed medial side in the lower aspects. This is the medial malleolus of the tibia, as it is the bone of the medial leg of a body. So the medial malleolus is a medial extension from the lower end of the tibia. So we start first with the upper end of the tibia. So basically the upper end of the tibia has the two meniscus. First is the medial meniscus, as you can appreciate here. This is the medial meniscus, and this is the lateral meniscus situated laterally. These are separated by the intercondylar area. These are separated by the intercondylar area. This intercondylar area is also known as the intercondylar eminence, as it has the two intercondylar elevations. The first one is the medial intercondylar eminence, this situated on the lateral meniscus or the lateral condyle. We are having the lateral intercondylar eminence. So this medial condyle is having the margins which is also known as the medial meniscus. The lateral condyle has the margin which is also called as the lateral meniscus of the tibia. Fine. So the tibial tuberosity faces anteriorly, and the shaft is having the three borders and the three surfaces. The first one is the anterior border, which is the very sharp S-shaped border. It extends from the tibial tuberosity up to the anterior margin of the medial malleolus. This is the anterior border of the tibia. It is the sharpest border of the tibia. Then we have the medial border of the tibia, which extends from the medial meniscus or the medial condyle up to the posterior margin of the medial malleolus. Here, then we have the lateral border. Lateral border extends from the lateral condyle of the tibia up to the lateral lower end of the tibia. Clear? So these are the three borders of the shaft of the tibia. Then we have the three surfaces of the tibia. The medial surface, which is present between the anterior border and the medial border. The lateral surface, which is present between the anterior border and the lateral border. Then we have the posterior surface between the medial border and the lateral border of the tibia. This is the posterior surface of the tibia. Clear? Basically these were the three surfaces of the shaft of the tibia. We have the lower end, which is not that expanded as the head of the tibia, so it should be placed downward with the medial malleolus directed medially. It has the five surfaces: the anterior surface, the posterior surface, then we have the medial surface, the lateral surface, and also an inferior surface. The inferior surface of the tibia articulates with the talus. Okay. This lateral surface or the lateral border, we can say, the lateral border is also known as the interosseous border of the tibia, as it articulates with the laterally placed fibula of our legs. Clear? So this border is also known as the interosseous border of the tibia. Okay. Now we start with the muscular attachments and the ligamentous attachments of our upper end, then shaft, and then finally the lower end. The shaft, having the medial meniscus, has the tibial collateral ligament, which is involved in the formation of the knee joint. Okay, we are having the muscles. First, the medial meniscus on its posterior end has the insertion of the semimembranosus muscle. The semimembranosus is inserted on the posterior surface of the medial meniscus. Then we have the lateral meniscus. On its anterior end, very important, that is Gerdy's tubercle is present, where there is the insertion of the iliotibial tract coming right from the gluteus part of the hip bone. Okay, there is the Gerdy's tubercle on the anterior end of the lateral meniscus. There is the semimembranosus being inserted on the posterior surface of the medial condyle of the tibia. Then we have the intercondylar area giving rise to the 6 to 7 ligaments. The first one is the anterior horn of the medial meniscus. Anterior horn of the medial meniscus. Then we have the anterior cruciate ligament of the medial meniscus. Then we have the anterior horn of the lateral meniscus. Then posteriorly when we come, then we have the posterior horn of the medial meniscus, the posterior horn of the lateral meniscus, and on the most posterior side we have the posterior cruciate ligament of the lateral meniscus. The anterior cruciate ligament is just located behind the anterior horn of the medial meniscus, anterior horn of the lateral meniscus, and anterior horn of the medial meniscus, anterior horn of the lateral meniscus, and there is the anterior cruciate ligament of the medial meniscus. Then we have the posterior horn of the medial meniscus, the posterior horn of the lateral meniscus, and the posterior cruciate ligament. Fine. This was the insertion. This was the ligamentous attachment on the intercondylar area. Okay. Then this comes the tibial tuberosity, which is very important because the tibial tuberosity is smooth in its upper part and rough in the lower part. The upper smooth part provides attachment to the ligamentum patellae. The lower rough part provides attachment to the subcutaneous infrapatellar bursa. Subcutaneous infrapatellar bursa, as it is below. That is the lower rough part attachment. Okay. Then we have the medial surface. We talk about the attachments of the surfaces now. The medial surface having the three muscles being inserted together in the form of SGT. You can memorize in the form of SGT. These markings are there representing the insertions of these muscles. The first one is the sartorius muscle, then the second one is the gracilis muscle, and the semitendinosus muscle tendon. They insert over here in this form, clear, on the medial surface. Then we have the lateral surface. The lateral surface in its upper 2/3 gives rise to the tibialis anterior muscle. It gives rise to the tibialis anterior muscle, which also originates from the posterior surface. Almost upper 2/3 of the posterior surface gives rise to the tibialis anterior muscle. Then we come to the posterior surface. The posterior surface is having a line which is called as the, here you can appreciate this line, this is the soleal line. Why? Because there is the origin of the soleus muscle, clear? So it is called as the soleal line. Above to the soleal line, there is the insertion of the popliteus muscle. It is being inserted in this triangular region above the soleal line, fine, and the soleal line gives rise to the soleus muscle. Okay, then we talk about the inferior lower rounded part of the tibia. We have the medial malleolus. Medial malleolus gives rise to the very important, the deltoid ligament on its lower end. The medial malleolus gives rise to the deltoid ligament on its lower end. Okay, then we have lateral fibular notch, which articulates with the fibula in its lower part. Okay, so we have the nutrient artery also, which supplies the tibia. It passes downward, that is, the direction of the nutrient artery is opposite to the growing end. So here we can appreciate there is the direction of downward of the nutrient artery in the tibia, means its growing ends are opposite. That is, this is the growing end of the tibia, and the downward direction is the growing end of the tibia. No, don't confuse with that. This downward direction is the direction of the nutrient artery, and the upward direction is the end which elongates or which extends during the growth. Means this part, the upper end, grows, the lower end does not grow. Clear? Okay, this medial malleolus is something which is subcutaneous. You can feel it near your ankle. Fine. Okay, so this was all about the tibia. I hope you understood. If you face any kind of doubt, don't hesitate to comment below. Thank you so much for watching the video.